it's so hard to manage diabetes these days because people don't even know what to eat, especially in this part of the country where I am in the Nigeria. When you open the internet, the food that they see is like the abroad kind of food which we don't have here. So don't worry yourself. In this video, I'm going to tell you the food that you will eat to manage your diabetes. I would have done a menu morning, afternoon, night, but unfortunately I'm not a dietitian and it's going to be quite stressful. However, I can refer you to one. But these are the food that you will eat to help manage your blood sugar level. Okay, the normal food is there, but then you eat their food that are meant for people that have low glycemic index. I know you people must have heard this. People that have diabetes must have heard this. Eat food with low glycemic index, but you don't understand what this means. Okay, so I'm going to be telling you those foods. Okay, so you can now use your your sense. Tell your daughters, your chef, to watch this video so they will know how they can prepare your menu for you if you are in Africa, especially in Nigeria. Okay, so let's get to it. Please, if you're not Nigerian, I'm so sorry, because this food I have to come down to our local dialect so that people will understand better. But I'll try as much as I can to push everybody along, foreigners that are watching this video also. Now let's go. You've already heard that eat food with low glycemic index. Okay, let's start with this normal rice that we eat, right? If you want to eat rice, I'm not saying you should not eat rice. You can go with local rice, the Abakaliki rice that okay, and basmati rice if you wish, but make it be in a small quantity. You can now put small rice, put small beans, or put rice, put beans, right? Let the beans overshadow the rice, then put a lot of vegetable. The vegetable will help bring the rice calories down. However, it's not the normal rice, but if you don't have money to buy basmati rice, you can go for the local Abakaliki rice, but make sure you put a lot of vegetable. It can be vegetable sauce, ogo, vegetable, pumpkin. That's one idea. They will do it for you with fish. Diabetes is expensive, but I'm sorry, they will do it for you with fish, dry fish and stuffs. Okay, let the vegetable bring down the rice calories, carbs. Okay, you can put beans, fine. You can also eat beans, jollof beans, or do your beans anyhow you want it. This is also very good. Then if you want to you can take oatmeal, oats instead of taking gari, or plantain flour. Instead of going to the market, your chef can dry plantain, dry them in the sun, right? Dry them in, or your daughter or anybody. If you can't afford the ones that they made in the supermarket, you don't have the time. However, those ones, most of the times, I don't know the brand, most of them used to mix them, right? But you can do them yourself or you can buy them. Okay, go dry them, then dry them very, very well. Then you can now go and grind them to get the flour. Then if you want to eat oatmeal, okay, oats, you can go buy the ones that is already made. Oatmeal, I'm putting the pictures here. Then turn it, use it as your eba, as your gari. Don't take gari, use it as your eba. Then take vegetable soup, okra soup, egusi soup, not really, but vegetable, okra or all of those soup. Once you take it in the evening, after, it depends on when you're doing when you want to eat, then eat it with them. Or you can use plantain flour, you can use oatmeal. Okay, and then in the morning you can decide to eat the oats. Oats is also it has low glycemic index too. The one there's a way they do it like pap with akara balls, right? It is made with beans too. Or you can also eat moi. Okay, or you can use this, right? It's sugar, but it's for diabetic sugar. There's another brand also called diabetic millie. I'm going to put all the names here. So what else? Okay, in your milk, if you must take milk, right? Don't take normal milk. Okay, don't take normal milk. Take skimmed milk, just small if you must, right? Skimmed milk. Normal milk are for us. Okay, but I don't take normal milk. I still take skimmed milk also, so that the calorie will come down. Then if you must drink tea, right? If you must drink tea, cocoa. This is pure cocoa. This is nice for you. There's no sugar, there's no calorie, there's nothing. Instead of drinking, if you want sometimes you want to drink tea with bread. You know, we don't want to alienate you people from our normal diet. You can eat all of these things. It makes you feel like you're eating, but it doesn't have high glycemic index. Okay. Watch the rest on my YouTube channel because the time is already exhausting. Then try to take your parents for a walk, or in the evening or anytime. Just this, take them for a walk, not like strenuous exercise if you're hypertensive. If they are diabetic, take them for a walk, right? You know, so that they can sweat a little bit. This will also help, you know, bring their sugar down. But make sure you monitor their sugar before they eat food, because when you work out, this really helps you bring your sugar level low naturally. So what else? Okay, the next thing to do is okwa is also good. Okay, okwa, begiri. I don't know, I've not eaten it before, but is it, I don't, is it begiri, that green thing, green slimy thing, is made from green? I think so. I'm at ewedu. Sorry, ewedu is also good. You can eat it. Okay, so these are the things that will help you. What else? I've mentioned wheat bread, oats. Sometimes if you don't have money, you can still eat wheat. Once you can eat wheat, but don't eat guy. Don't eat guy. So there are times that are cheat days. You can cheat once in a while, but make sure you take your drugs. Then try to take natural things like ginger with and garlic with hot water. This will also help you reduce your blood pressure, reduce your sugar level. Okay, so that basically is it. If I have any other thing that comes to my mind or any other updates, I'll let you know. Remember, I'm not a dietitian, but with experience that I managed to get this. Okay, however, still consult with your dietitian, but these ones I give you are perfect fit for people on diabetes. Very important, I forget to mention, try to manage your salt intake, right? Manage your salt intake. Then these beverage drinks, it has a lot of empty calories. Stop them. Okay, stop them. Before, if you continue like this, especially the exercise part, if you're always one side, if you continue like this, you see, instead of taking your diabetes drug, sugar drugs 3 times in a week, you find out that you'll be taking it like maybe 3 times in a day, whether you'll be taking it once in a day. And I have a very good doctor that deals with diabetes. Okay, I can refer you to him if you are interested.